Hey, Dr. Kyle, I do not want to stop smoking because I enjoy it. I like the feel of it, and I am aware that it is bad for my health. And it's okay for me if I die a little bit sooner, but at least I'm happy with my life. That statement, in and of itself, I have to respect that. Hey, how's it going? Everyone, happy Sunday. For those of you who do not know me, my name is Kyle. I'm a doctor of physical therapy and I'm a American board certified orthopedic clinical specialist. I have an MBA in healthcare management and I am a champion performance specialist. I was credited by the head athletic trainer of the Boston Red Sox, Mike Reynolds. Today's topic will be about questions of patients who want to improve their health but do not want to stop smoking. A lot of times this comes up for people that are a little bit older who have a lot of comorbidities already. Comorbidities mean a lot of pre-existing conditions. For example, a patient came to me and his main diagnosis, for example, was acute exacerbation of congestive heart failure. It just means that this patient has congestive heart failure for a long time and it flared up for whatever reason that may be. Moving on to the question or the topic of smoking, if a patient tells me that he or she does not want to stop smoking for whatever reason, my job is not to shame patients, but to educate patients, i.e., hey, Dr. Kyle, I do not want to stop smoking because I enjoy it. I like the feel of it, and I am aware that it is bad for my health, and it's okay for me if I die a little bit sooner, but at least I'm happy with my life. That statement, in and of itself, I have to respect that. I have to respect that person's autonomy and free will because that's what he wants. He's already aware of the repercussions of smoking. However, if this patient asks, what are other ways to improve my health without giving up smoking? Then my job is to educate that patient with everything that I've known and as much as I can, because it is still my job to educate this human being. So it would most likely be improve your diet, cut down the sugar, cut down the bad fat, bad LDL. I will most likely differentiate different types of fats. I would tell him or her to even cut down on soda, cut down on salty food, ease up on the restaurant food. I'm going to tell him or her to adhere to your medications. If he has dementia or cannot remember things, then it's my job to educate the family members. If he's agreeable to it, I'm going to educate the family members on what to do for this patient. Third is I'm going to educate this person on exercise and movement, on how it can improve his cardiovascular endurance, on how to improve his heart health, how it can improve his lung capacity, how it can improve his cardiac output. I am going to educate every single thing that I know about exercise, about diet, and at the same time, I'm also going to educate this patient on the detrimental effects of smoking. That you can get a stroke, it can impair linings of your blood vessels, it can impair your lung capacity, you can get lung cancer. I'm not saying that you will, but you may. It can exacerbate your congestive heart failure, it can exacerbate your asthma, it can exacerbate your COPD, and all these negative side effects can happen to you, or you can get cancer. Once I've done that, then my job is done. My job is done. I'm not here to scold you. I'm not here to put you on shame. I have family members, I have friends that smoke. But once I'm with them in a social setting or a family gathering, Dude, I dropped my physical therapy. I dropped my clinician hat on. I'm Kyle. I'm your nephew. I'm your cousin. I'm your son. I'm your grandson. And if you want to live the way your life that you want to live, that's okay. Because I will love you no matter what, and I will care for you no matter what your decision is. And by that time, most patients, most people know that it is bad for them. And I've heard people say like, "Oh, matigas ang ulo" or hard-headed. I normally don't say things like that. I'm not saying I'm judging the people who do, but I don't, that's just not who I am because that person is aware that this is bad for them. They already know they're not, I don't treat patients like babies. They're not dumb. That is their decision. And if they want to live their life the way they want to live it, and they come to me because they want alternative reasons, I will give you everything that I can. But I'm not gonna give you a guarantee that you can live to 100, but I can give you everything and educate you with all that I can. My take on it is respect everyone. I respect all my patients. I treat them as if you were my friend. And you will get the same respect from me as the way you treat me, and the way I respect my mom, my dad, my grandpa, my sister, everybody. You'll get the same one, and I will not judge you or any patients for whatever you did in your life. You did drugs, you smoked, you did alcohol, whatever. We're all human, we all make mistakes. And if you come to me to want a better life, to educate you with movement-based exercises, how medicine can help you, how food can help you, I'm here for you. That's how I see it. This is a judgment-free zone. I'd like to surround my people who have similar beliefs as well. And that's how I see people. I see them as my equals and not my patients, but I see you as a human being. Feel free to comment below. And I miss you guys. If you have any questions about pain, about health, about how to improve your life, exercise, if you're struggling with anything, feel free to inbox me. I will do my best to steer you the right path and the right direction with with the best to my ability. It's my way to connect with everybody in the whole universe with everything that's going on. Take care and God bless.